Hello, everyone.
Hello.
Start. Good morning and good afternoon, everyone. Distinguished panelists and audience members, friends and colleagues, it is a pleasure to welcome you to today's webinars on justice responses to gender-based violence in the context of COVID-19 pandemic and its aftermath. Thank you so much for joining today. I'm Ilaria Bottigliero, the Director of Policy, Research and Learning at the International Development Law Organization, IDLO. IDLO is an intergovernmental organization devoted to the rule of law and justice. We operate in over 40 countries, and we are currently implementing around 70 justice and rule of law programs. Combating gender-based violence, especially violence against women and girls, is a critical component of IDLO's strategic plan and of our gender strategy. We all very much look forward to the discussion today, but before we proceed to the substance of our discussion, I would like to just highlight a few important items and housekeeping rules. They were also sent to you earlier, and my colleagues will put it on the screen now. The event today will be recorded. The recording and a post-webinar report of the panel discussion will be made public in order to inform wider policy discussions on addressing the justice needs of survivors of gender-based violence during and after the COVID-19 pandemic. Throughout the webinar, we will have our chat room open, enabled. So on the bottom of your screen, you will have the possibility of clicking on the chat room if you want to send message and communicate with all other participants through the chat room. If you would like to ask a question, please use the question and answer window. So you will see a button again at the bottom of your screen that says Q&A. My colleagues from IDLO, Rea and Raluca, will monitor the Q&A window and will communicate all questions to me. Please do not send questions directly to the panelists. You can also send questions to Rea or Raluca via the chat window if you prefer. And all the questions will be directed to me and I will convey them to the panelists. We will have 2 dedicated time frames, 2 spaces for Q&As. We are expecting quite a high level of participation today, so we'll try our best to answer all the questions live, but in case we do not manage due to time constraints, we will also try our best to get back to you bilaterally after the webinar. So thank you in advance for your support, and again for joining today. It's very exciting to see so many of you linked in. Let's start with our discussions. We are convening this webinar today at a time where there is increasing evidence that the ongoing global pandemic is fueling widespread violations of women's rights, including elevated risks of domestic violence and other forms of gender-based violence. We have all witnessed with concern the surge in domestic violence and overall in violence against women and girls in all regions of the world. No country is excluded. In our report, Justice for Women Amidst COVID-19, which we developed with UN Women, UNDP, UNODC, the World Bank, the Pathfinders, and the Elders, we show that the justice gap for GBV survivors is actually worsening. Law enforcement and health professionals, who are ordinarily first responders for women and girls, are becoming increasingly strained in dealing with the demands of the pandemic, sometimes leading to a deprioritization of GBV complaints. As healthcare workers become overburdened and prioritize COVID-19 cases, urgent support, for example, clinical management of rape, mental health assessment and care, including psychosocial counseling for survivors of violence, may be disrupted. Now, compounding this, many services needed for GBV survivors may be deprioritized, including shelters, sexual and reproductive health care, specialized police and justice services, thus limiting the public sector's capacity to reach out to and support survivors. Accessing help can also be more difficult due to confinement with the abuser. In a nutshell, COVID-19 is changing how justice institutions work, and these include courts, police, prosecutors, lawyers, and prisons. Many countries have temporarily postponed all non-urgent court hearings and are seeking ways to keep the courts running through information and communication technology for remote access, including via video or telephone hearings. Some courts are also utilizing emails for submission of protection orders, such as in cases of intimate partner violence, and for other urgent requests. In many locations, all of these are within the context of existing case backlogs, as well as high level of underreporting and case attrition in so-called normal times. Furthermore, because of this change, there is often a lack of intra and intersectoral coherence on rules, protocols, processes, and procedures to deliver justice services for GBV survivors. IDLO has taken stock of these challenges. We are trying our best to initiate action in several countries and within the existing programmatic portfolio on justice and gender-based violence to improve access to justice for survivors of GBV. In Kenya and Tunisia, for example, steps have been taken to set up virtual legal aid mechanisms that serve GBV survivors. In Myanmar, IDLO is providing assistance in targeted responses to COVID-19 and its impact on the justice sector through the development of video content on sexual and gender-based violence. My colleague Tara will also speak about our initiatives in Mongolia. And I know that all of you, all of us, are looking into solutions as well, so that the aim of our discussion today is to catalyze that exchange and to enable learning on lessons, entry points, and existing solutions or emerging solutions available to ensure access to justice for GBV survivors. Now, we are very, very fortunate today to have a very distinguished panel of speakers. So thank you so much to the panelists for joining us today, as well as an audience that includes a large and diverse group from around the world and coming from so many constituencies. So thank you to all the participants for joining us today in this discussion. Together with the panel, I would invite you to explore three key questions for today's discussion. The first one has to do with the main challenges to the justice sector in delivering survivor-centered responses to GBV during COVID-19 and its aftermath. Then, as a second area of focus, we would like to explore innovative emergency solutions to protect GBV survivors during the COVID-19, but also in the aftermath, especially the ability of survivors to access justice and related protection and support services. And third, we would also like to talk a little bit about good practices and approaches for justice sector programming to prevent and respond to gender-based violence during the COVID-19 outbreak. So what can we do about prevention? And with this brief introduction, I would like to introduce you to the first panel of speakers. We have three eminent colleagues who are going to compose the first panel of speaker. Professor Mary Ellsberg, the director of the Global Women's Institute at George Washington University. Hello, Professor Ellsberg. We also have with us Dr. Beatrice Duncan, who is the Policy Advisor in Rule of Law, Justice and Constitutions, Leadership and Governance section of UN Women. Hello, Beatrice, and thank you so much for being with us today. And we have in the panel Justice Henrietta Volayo, who is the President of the National Association of Women Judges of Uganda. Thank you so much, Justice, for being with us today. Now, Professor Ellsberg, you've heard the questions, and we are all looking forward to hearing from you. Perhaps, what do you see the situation being at the moment? And do you see a change because of COVID, or is it an exacerbation of pre-existing conditions? How do you see it from your perspective? What can you tell us about the so-called GBV pandemic that we are experiencing at the moment? The floor is yours. Thank you, Professor Ellsberg.
Thank you very much, and it's a great honor to be here today. I'm going to speak for a few minutes about, to give you a snapshot of actually what the situation for women and girls and survivors of violence was even before the COVID pandemic started, to set the stage for my colleagues coming up. And I think it's important to remember that this year, 2020, is the 25th anniversary of the Beijing Conference for Women, and the 20th anniversary after the UN Resolution 1325 for Women, Peace and Security. So we have been working for many years now to improve access to justice, to provide of violence, and more recent in 1976 and 2018, over 75% of countries in the world had developed or enacted laws against domestic violence. However, as we know, laws are just the first step, and getting them enforced, resourced, and fully implemented, and having the public know about them and be able to use them are all the many steps that come afterwards. So despite all of these laws, we realize that still most of them have not been resourced, and they're not being fully enforced. And impunity is still the norm in many, many countries. So you could say really for many women on the ground, so far little has changed as a result of the new laws. For one thing, often the public is not aware of the laws and how to use them, and even police and justice and judges are not fully trained or even understanding the laws well enough to apply them. As a result of this, we realize that most survivors of domestic violence still do not report crimes to the police or to the judiciary, due to shame, to stigma, to fear of retaliation. And in the case of sexual violence, the reporting is even more rare. Most cases thus far are not fully investigated or prosecuted, and the great majority do not even make it to the courts. We also know that discriminatory attitudes among judges and police are very common, and we have evidence that this has an impact, this influences judicial decisions. So still, when we look at the justice statistics, we realize that very few perpetrators are actually sentenced for their crimes. In some areas where we've conducted research from the Global Women's Institute, such as Papua New Guinea and South Sudan, traditional justice, for example, compensation for violence or for spilling of blood, forced marriage to rapists, are still the norm, and particularly in rural areas. So moving to the issue of services, there have been great improvements across the board in the last 2 decades. First of all, we have many more hotlines, shelters, one-stop service centers in many countries. There are women and children's police stations that are connected to referral services throughout the community, with social services and psychosocial counseling and case management, all of which have improved greatly. The World Health Organization has developed comprehensive clinical guidelines for health providers to be able to identify women who are suffering abuse in their services and also refer them to specialized support. And also, I think my colleague from UN Women will probably be mentioning the essential service packages that are being implemented now by many countries. However, despite these advances, services are still woefully underfunded, and quality is very uneven. There's a real lack of coordination among services within a community, and most importantly, most services are still centered in urban centers, usually capital cities. And so for women in the rural areas, for poor women, for women who are marginalized by disability, ethnicity, LGBT community, have the least access to services. And this is even before the COVID-19 pandemic. I'll move now to prevention, and this is an area where we do have also a lot of progress, and particularly just in the recognition that it's not enough just to provide access to services and to justice, but that we really need to be much more concerned with preventing violence. And the good news is that we have much more evidence now about how to prevent violence, and we know that violence can be prevented even on a large scale. There have been several studies and innovations such as the SASA program that many of you are probably aware of, a community mobilization approach that was developed in Uganda by Raising Voices and CEDOVIP, and it found that 50% of the population of violence was reduced in a 2 or 3 year period, which is really quite extraordinary. And many other programs in prevention, including cash transfers combined with empowerment training, parenting, home visitation, have also shown great success in prevention of violence. And so to sum up, I realize I'm getting to the end of my time. We still need to understand how to bring these programs to scale and to reach different populations. Finally, something that we really need to bear in mind is that these laws don't happen by themselves. Studies have shown that the countries that have the best laws and policies on violence against women are those that have autonomous women's movements. And the civil society and the women's movement have been absolutely essential for bringing about the changes that we have right now. And unfortunately, we see that in many cases, they are being absolutely underfunded, and in some places, democratic spaces are really closing, and women's movements have less opportunity to carry out their activities. So this just gives you a very quick snapshot of the situation before COVID-19. And then of course, with the devastating impact of the pandemic, my colleagues will talk about how the situation has been even exacerbated.
Thank you, Mary. And you're right, this is a pre-existing problem, and we are seeing a worsening of the situation at the moment, but it's clearly something that we needed to address as a structural problem. I'm turning now to my UN Women colleague, Dr. Duncan Beatrice, thank you so much for being with us today. What do you see being the main challenges to the justice sector in delivering a survivor-centered response to GBV during COVID-19, but also as part of the recovery problem? Thank you, Beatrice, the floor is yours.
Thank you so much, Ilaria. I'm so happy to be with you this morning. And this subject is of utmost importance to UN Women. In fact, it's the real foundation of our mandate, and the issue of ending violence against women is our second largest program at UN Women. So this tells you the level of attention to which we are paying to this issue. Indeed, COVID-19 has brought about a multiplicity and a domino effect across all sectors, and this has severely impacted upon the justice sector. Indeed, we have seen a threefold increase in domestic violence, because we know that 162 countries have embarked upon lockdown measures, many of which are still persisting in different degrees. And we also know that 177 countries have also embarked upon school closures. So this is impacting severely upon women in many fronts. So first and foremost, we see the increase in rates of domestic violence, but we also see an increase in women's care burdens at the domestic level. And because sexual reproductive health services have not been prioritized or seen as essential, within the context of domestic violence, we also see that women cannot have access to essential services. But even though the issue of violence against women is the issue at stake today, I just want to make an argument for us to see the woman from a holistic perspective. And so this morning, I'm going to be sharing with you some perspectives that I believe could help us in addressing the escalating ways in which domestic violence has surfaced during the COVID crisis. So as UN Women, we are managing a number of violence-related portfolios, and I thank Professor Ellsworth for highlighting the program that we have on essential services package for women. So that's a holistic package that we are delivering across all our countries where we operate. But in addition to that, we also have an engagement with religious and traditional leaders. As Mary once again mentioned, the situation with harmful traditional practices have not ceased as a result of COVID, nor are communities perturbed by social distancing and the dangers that can be associated with COVID-19 when these measures are not complied with. So we are seeing actually an escalation of harmful practices, especially in rural areas, with specific reference to early marriage and FGM. And this is happening because these two practices are seen as a coping mechanism for families and communities. And as many of you may know, we are also managing a huge portfolio around the Spotlight Initiative, which is a multi-partner initiative which brings together several partners to enable us address violence against women from a holistic standpoint, from prevention, as well as a multi-stakeholder approach to delivering essential services. But from where I stand, I would like to present to you what I think are the key deliverables that could possibly help us to attack this issue head on during this season of COVID, as well as post-COVID, as we build back better. So in many countries, we know that parliaments are focusing more on stimulus packages and social protection measures. So what we are trying to do is to work with parliaments to keep them alive and awake on the issue of violence against women and other related issues. So we have selected a number of countries where we've already started working with the parliaments to adopt a COVID-19 sensitive approach to parliamentary business. And we've been knocking on their doors to continue with their work of legislative deliberation, especially around the minimum age of marriage. In about 90 countries of the world, child marriage thrives because it is sanctioned by the state. So what we are trying to do is to use the opportunity of the COVID crisis to see and test this, the sensitivities of the parliamentarians and the women's caucuses of parliament to address these issues at this point in time, in addition to the stimulus packages that they've been preparing. We've also been raising awareness among women themselves and creating platforms for them to understand what it means to be in this particular situation and where they can get services in their respective countries. But in addition to that, we have also been studying these stimulus packages with a careful eye to understand the extent to which they have been gender responsive. So we have a team at UN Women who are actually on a daily basis looking at the macroeconomic environment to understand whether sufficient resources are being allocated to addressing violence against women and other areas. But more importantly, we have also understood, I mentioned earlier that we need to look at the woman more holistically. So by that, I meant that not only are we looking at, violence against women as a standalone, but we are also looking at the woman to see how best she can also be empowered. And a careful review of what several of our country offices are doing as at now suggests that we are providing a lot of economic empowerment support to women. Several women now through UN Women's Support are actually participating in the production of protective gear, be they face masks and hand sanitizers. And so this, we believe, is a measure that can be used to empower women against violence at the domestic level. We are also supporting women to participate in the design of the COVID response in their various countries, as well as the post-COVID response. And by this, I mean minority women, indigenous women, women with disabilities, and women in rural areas. Another important issue that I wish to bring to the attention of the meeting is the need for us to look at justice sector strategies all over again, because COVID-19 has taught us that the current justice sector strategies that are in place cannot survive COVID. If anything at all, they've also been infected by the virus. So we need to look at these justice sector strategies, and I would like to propose a new generation of justice sector strategies that actually learn the lessons not only of COVID, but also Ebola, because the Ebola crisis as well as the COVID-19 crisis are brothers and sisters, and we ought to learn the lessons derived from these experiences. We are also expanding upon our work on legal aid. UN Women believes that legal aid is the pathway to the legal empowerment of women. In 2018, we reached out to 30,000 women with legal aid. In 2019, we reached out to 150,000 women with legal aid. And we would like to expand upon this service because we believe that through this, women who are going through various forms of violence and other forms of gaps in their lives would be able to receive a service directly. So we are using the mechanics of the technology to be able to reach out to women. And we are also working with women in the media to deliver messages on women's rights so that these are respected. And some of you may have heard, and this is my final point, that we've also embarked upon an ambitious program of elevating the unfinished business around the review of the Beijing Declaration and Platform for Action. So we are doing so through a process known as generation equality. We are bringing bridging generations, especially with young women, young men, as well as older women, to understand what it means to really push the needle around gender equality. And through this, we have also identified an action coalition on ending violence against women. And this is going to serve as a powerful tool to really raise the agenda around violence against women through a multi-partner stakeholder approach, which is really going to create a lot of noise with civil society participation, governmental participation, UN participation, and private sector participation. So I'll end here and look forward to the discussion. Thank you very much.
Thank you so much, Beatrice, and excellent point. I very much like the idea of a new generation of justice sector strategy. I think really timely, and of course we're all behind the Generation Equality campaign and trying to push forward some of these messages as much as we can. I'll turn the floor now to Justice Volayo. Justice Volayo, from your perspective, what would be, or what are the good practices that you have seen in your work, the new approaches to justice sector programming to prevent and to respond to the COVID-19, to the gender-based violence within the COVID-19 framework? The floor is yours, Justice Volayo. Thank you.
Thank you, Ilaria, and thank you, the previous speakers, for laying the ground for me to go into some good practices and approaches to prevent GBV amidst COVID-19 from the Uganda perspective. GBV is a very big problem in Uganda. It has always been, and it has gotten worse during this lockdown. By the end of April this year, the police had recorded over 3,000 complaints of GBV. The sector heads, that is the justice, law and order sector, they have responded to the justice needs of the community, including GBV, by giving clear guidance to the justice actors within the institutions on how to manage these law, order and justice issues as they emerge. The judiciary on its part, under the leadership of the Chief Justice, issued guidelines on how courts will operate during this period, and he directed that courts will focus on applications, really call them urgent applications, and plea taking of new criminal cases. There's a challenge with this, just focus on applications, because it's in the discretion of the presiding judicial officer to determine whether an application is urgent or not. Women potentially would benefit, the victims of GBV would benefit from, from this, system, because their cases are urgent. They need protective orders and all that. The good thing is most of the judicial officers at the lower bench are women, and we are confident that they will be able to see that these cases are urgent and give the necessary relief to these survivors of GBV. Now, with regard to the police, these have continued to utilize the women and children's desks to respond to, to give emergency response to women in need. Actually, they've done a very good job, and we've seen many perpetrators charged before the courts of law. surprisingly, the public has also been very involved in preventing GBV during this period by recording incidents of domestic violence as they unfold and sharing those videos on social media. The police have been able to pick up on this and make arrests and, of course, carry out further investigations. The prisons, specific prisons have been designated for remanding suspects during this COVID, of course, for obvious reasons to prevent spread. And obviously, the women also have special places where they are incarcerated during this period. Our local leaders at grassroots level have been very instrumental in preventing domestic violence and responding to, they're the first responders to most of the scenes of domestic violence. When I say local leaders, I mean the LC chairman and women, chairpersons, the resident district commissioners, and others. They've done a tremendous job, and they've always called upon the men in their areas of jurisdiction to desist from violence. Religious leaders have also spoken out against domestic violence from their pulpits. Although we are not congregating in churches, they speak up on radio and TV. Civil society has also provided shelters to victims of violence. And yes, the United Nations High Commission for Refugees has in place a response plan for women and children in the camps who need assistance. Nawuj judicial officers, the female judicial officers, have also responded at an individual level within their communities. So we've encouraged them not to keep quiet when they see a child being abused. They should rescue that child or call the police. And they've done a tremendous job. We've shared all the instances on our WhatsApp group on what we've been doing individually in our communities to assist these survivors. Lastly, I cannot leave out our head of state, who has been very supportive. He has spoken out loudly against domestic violence and condemned it and asked men to desist from abusing their wives and children. Now, going forward, judiciary will continue with these special sessions. Before COVID, we were having special sessions focused on gender-based violence cases. So these are going to continue. In fact, right now we are easing the lockdown, and soon courts will be fully operational. And lastly, the justice, law and order sector is continuing with its plans to establish a special court to handle GBV cases. Thank you for your attention, for listening to me.
Thank you, Justice. That was very, very insightful. And I see already a number of questions rolling through the Q&A screen. So we are opening up the discussion for the panelists. I have a couple of questions for Beatrice. Beatrice, our participants are wondering whether the assessment that UN Women is conducting on the stimulus packages from a macroeconomic perspective would be available online. And they would also like to hear from you. You made mention of your work involving women or encouraging women participation in the COVID-19 response. So our participants would like to know whether you could share a bit more information on how UN Women is doing this, and whether there is any immediate impact or response from such engagement? And then I have other questions for the other panelists, but perhaps Beatrice, you can answer already these couple of questions. Thank you.
Thank you very much. Yes, so the review of stimulus packages and the broader macroeconomic response to COVID from a gender responsive is ongoing. I will definitely be in the public domain. So that's good news. And secondly, the way by which our country offices empowering women to participate in decision making affecting COVID is by creating a platform for them to do so at country level. So in fact, there have been diverse forms of platforms, but all of them have been online. And these have been different webinars, which have enabled women to interact, to share experiences, and also to indicate what they deem as the way forward. And in several of these webinars, there have been governmental officials, especially the national gender machineries and the social welfare organizations, listening in and interacting with the women. So these have been through webinars such as these, where we have seen the engagement over hundreds of women. And I think that this kind of platform that we have today has been an enabler for women across the world. Without these platforms, I don't think that women would actually be visible. So this has been the channel through which we've engaged and supported the women. Thank you.
Thank you, Beatrice. We have a question for Justice Bolayo. The Max Planck Foundation for International Peace and Rule of Law is asking whether you would have any advice for to support the Afghan Women Judges Association in their difficult path to advocacy and empowerment. So based on your experience, what would be your advice for the Afghan Women Judges Association? Thank you, Justice.
Currently, we have an association of, we call it International Association of Women Judges, and we also have a chapter called IAWJ Africa Region Conference. So as for the African women judges, I think this is a good initiative. It's good. It complements what the IAWJ is doing in bringing women together in order to mobilize and support each other, to develop programs and share best practices on how to address, justice for women, especially in our individual courts. I think we will always benefit from sharing the best practices, how we approach this. A lot of these cases, we share judgments online, and these are some of the entry points into how we can all benefit from each other's probably knowledge and experience in handling cases involving women.
Thank you, Justice. A question for Professor Mary about Latin America. Latin America is the continent with a COVID, with great COVID problems, as well as a refugee crisis, and reproductive rights of women are crushed, and women are suffering spontaneous abortions and charged with murder and corruption. Professor, do you think there are approaches for the region that could support the situation of women in lockdown and beyond? And is there going to be a voice representing the region? What would be your advice related to women, femicide, COVID-19, and corruption? Thank you. from Casa Grande University UNESCO chair.
Thank you very much for that question. That is a very broad question to answer in just a few minutes. But I think just to agree with you that it's absolutely true that Latin America is one of the regions now that is really a hot spot for COVID-19. And it's just getting worse and worse. And in some countries, there have been some notable countries where they haven't really been taking public health measures to enforce social distancing and to reduce the spread of COVID. And where they are carrying, and a few other things that I think are important to mention is that in Latin America, there are also governments that have been taking advantage of the COVID-19 pandemic to decrease civil liberties and towards a more authoritarian sort of response in general to civil society and to dissent. So that's an issue that is worrying us a lot. You mentioned the issue of women being arrested and charged for abortions. That's also been the case in many countries for several years, such as Nicaragua, where abortion is illegal for any case, including incest and the life of the women of the mother in jeopardy. So I think it's right now what we're seeing is a perfect storm where there is isolation and quarantine. Women are much more vulnerable. They're unable to access services, and at the same time, there is a real lack of attention to this from governments. And so I think that, as you've said, this is a much broader issue than COVID. COVID was existing before COVID. COVID has made it much worse, and we really need to be using different kinds of methods that have been used in other places, such as improving, first of all, putting more funding into shelters and services, ensuring that women are able to get away from violent situations, hotlines that have been increased in many areas, and counseling for women, and many of the other innovative practices that we've been hearing about from Justice Walayo and Beatrice.
Thank you, Mary. There are so many questions, and I'm so happy to see that there are questions, but I would take only one final question, and Beatrice, perhaps you can help us answering this quite fundamental question. You talked about a holistic perspective, holistic approach to the issue. So there are a few questions related to the involvement of men in the fight against GBV at every level. So how do you see men being involved in our fight against GBV, which of course needs to involve all of us?
Yes, thank you very much. That's a very important question, the involvement of men and boys. So as I mentioned earlier, we do have a very specific engagement with traditional rulers and religious leaders from across the world. And in fact, we've had face-to-face engagement with very prominent ones across all the regions where we operate. And the idea is to get their buy-in and support to eliminate two specific forms of gender-based violence. And these are early marriage and FGMC. And this is really working. In one session that I attended in Malawi, I can see that some of the participants are from Malawi, so they can attest to what I'm saying. But about 18 months ago, there was a very big meeting of particularly male and a few female traditional leaders and religious leaders, where we discussed these issues at length. And we had young women testify before them on the impact of these harmful practices on their lives. And at the end of that meeting, the traditional and religious leaders actually rendered an apology to the young women for the pain that they were going through. And this is now being translated into action as well as into policy. So these are some of the things that we are doing at the community level. And then at the national level, we are mainly engaged with parliaments. During this COVID crisis, we've prepared several guidance pieces to enable parliaments to keep an eye on gender equality during this period of time. And so, as we know, parliaments are heavily dominated by men, but part of our agenda is to get more women into parliament. But even as they deliberate on national issues, we also support them to do so through a gender perspective. So these are the two specific examples that I can provide for now. Thank you.
Thank you very much, Beatrice. And with that, we will conclude the first round of open discussion and move to the second panel. So thank you so much to our first distinguished panel for your insight and views. Our second panel of speakers is also composed by three speakers. And the first one is Liza Masuda Lamia, who is a member of parliament of the Bangsamoro Autonomous Region in Muslim Mindanao, the Philippines. Hello, Liza. Then we also have with us Fabienne van den Eyde, the Deputy Head of Unit for the Gender Equality, Human Rights and Democratic Governance of the Directorate General for International Cooperation and Development of the European Commission. Thank you, Fabienne, for being with us. And we also have our IDLO country manager in Mongolia, Tara Neal. So thank you, Tara, who will give us the IDLO country perspective. But without further ado, I'm going to give the floor to Liza, who is going to tell us a little bit about the local situation and how do you see the GBV crisis unfolding in your region and sub-region. Thank you, Liza. The floor is yours.
Thank you very much. Thank you to the IDLO for inviting me. Good evening in the Philippines, good morning and good afternoon in the rest of the world. Every day the COVID-19 pandemic reveals that many facets of its impact to the people, the economy and institutions. The past months in particular brought challenges that seemingly affirm that we're facing more than just a health crisis. That trying this pandemic in with gender-based violence paints a multi-layered picture of unresolved root causes and elements, including systemic gender inequality, power imbalance, harmful gender norms, among others, and combine that with emerging problems caused by restricted mobility as a result of the pandemic. But for this talk, let me focus on the latter and how it significantly affects the justice system that is supposed to prevent or respond to GBV with some innovative solutions. Here in the Philippines, a total of over 3,600 cases of violence against women and children have been reported since an enhanced community quarantine, that's what we call it, was imposed in Luzon, the northernmost part of the Philippines last March. From March 17 to May 23, based on data from the Philippine National Police, around 602 people, or an average of 8 people a day, became victims of rape across the country. In the Bangsamoro Autonomous Region in Muslim Mindanao, where I serve, it's at the southern part of the Philippines, police authorities cite 61 reported cases of violence against women and children from March to June. These figures may seem small to some. They are likewise lower than the number of cases reported in the previous months. But these numbers merely represent the cases that reach the justice system, which does not discount the fact that GBV is vastly underreported. What then are the main challenges to the justice sector in delivering response to GBV in this time of the crisis, the pandemic crisis? Now, the COVID-19 pandemic exposes and widens the cracks in our country's already fragile justice sector, the restrictions in mobility, the shift in focus and resources of the public sector, and the abuses and incapacity in enforcing laws serve as main challenges in the sector's response to GBV in time of COVID-19. And these are manifested in the following. Number one, leading law enforcement agencies in the country, such as the police and civil emergency agents, are being tapped right now to oversee quarantine protocols, despite calls from the government to adopt a health-centered approach in tackling the pandemic. For months now, the police were called to man checkpoints, enforce community quarantine rules, making sure that everyone stays home and apprehending anyone who does not. Now, this programming shifts the focus and resources of our law enforcers from providing a wide range of police services to the citizens, including victims of GBV. The effort and time resources they pour to enforce COVID-19 laws mean lesser effort, time, and resources to enforce all other laws. It is a zero-sum game, especially when our police force has limited financial capacity and human resource to begin with. Emergency response and operations, for example, are quite problematic in our country. Filipinos find it hard to trust our emergency hotlines, for example, the GBV hotlines, more so the timely and effective assistance from responders. Now, this gets worse when the abuse is perpetuated by the authorities themselves. For example, survivors of what we call the sex for pass came out in open court last month, where they unmasked the scheme of some policemen sexually abusing them and other prostituted women in exchange for passage through quarantine checkpoints. While human rights violations and abuse of power are not new in law enforcement agencies, this pandemic and the agents' newly vested roles in managing it are seen to have given them new platforms to continue these alarming practices. Second, the judicial system. The Philippine judiciary, as traditionally the most conservative branch of government, adopts the new normal as it unveils virtual courtrooms and conducts virtual hearings nationwide to continue carrying out the administration of justice in the country. Now, this is crucial as it needs to navigate through its backlog of cases filed even before the pandemic. The complex problem of a gender unresponsive criminal justice system is a challenge with or without the health crisis. The access of GBV survivors to justice will continue to be limited if the judiciary and our very laws prevent us from holding perpetrators accountable for their acts. The pandemic comes into play in several ways, but in the local context, for example, it further impedes prosecution services with the quarantine protocols in place. And second, it prevents legal aid bodies and public representation to actively provide services in responding to GBV cases. Now, an unusual effect of this that is unique to Philippine context, I think, is that GBV survivors, tired of trying to gain access to the formal justice system, resort to alternative and often exploitative dispute resolution mechanisms. And this is widely practiced in the media, as we see this in radio programs, TV shows, and even social media platforms. We would see victims of domestic abuse or intimate partner violence come out in the open, discussing their predicaments to the hosts of shows and celebrities posing as mediators, hoping that this can help them attain justice. Now, these platforms, however, do not seem to translate into concrete and sustainable resolution, nor to prove to be effective in holding abusers into account. Now, this practice also tends to defame or shame individuals and victims, which is counterproductive to our efforts in erasing the stigma surrounding all forms of GBV and empowering survivors. Third, years long of advocacies and reforms have been trying to address the complicated relationship between the Philippines justice sector and its oversight authorities over the years. The pandemic not only delays but also harms these institutional reforms as it surfaces and widens inequalities in societies. Evidence shows that our human rights and anti-corruption commissions and even the ombudsman still fall short in pursuing accountability in abusive authorities. And there are also systemic problems in courts vis-a-vis the executive authorities responsible for their administration and management, for example, the Justice Department. Now, all these challenges that are already existing further limit the access of GBV survivors to justice in times of crisis like this. Now, COVID-19 reinforces corruption, patronage, and impunity as it tends to make justice accessible only to those who have the power and resources. To clearly state my point here, picture this. The LGBTQ members who joined the protest against the country's pending anti-terrorism bill were arrested by the police, who unfortunately could not explain the arrest. This happened last June 26. Now, these police officers are working for the same institution, who some of their members violated the quarantine and distancing measures when they gathered to celebrate the birthday of one of their police chiefs last May. So the challenge of working around these problems remains. And as we try to act on our human instincts to survive this pandemic, we also see various good practices and innovative solutions to progress the sector's function and the overall campaign to end GBV. Most of these make use of one thing that remains to be abundant to some during this crisis, and that's technology. The past few months witnessed a peak of online protests that call out abusers, GBV abusers, seek the attention of institutions and empower the voices of survivors. For example, the Hija Ako campaign on Twitter. It's Spanish, it comes from Spanish, the word hija, or a girl, I'm a girl. Hija Ako campaign on Twitter encouraged women victims to tell their stories of abuse and inspire others to do the same. The trend was driven by empowered young women and men who find a safe place on social media platforms. While this does not concern the justice sector directly, this online culture may help in encouraging help-seeking behavior among GBV survivors. Another innovative solution, the Supreme Court is also adopting as it works to digitize services in over 2,600 courts nationwide. And it has activated what we call, and partnered with Microsoft, the Philippine Judiciary 365, which has video conference and email features, the setting up of one-stop-shop crisis centers, and finally, in my province, in Basilan, in the Bangsamoro Autonomous Region of Muslim Mindanao, because this is a multi-dimensional problem. Women have been participating in a program that aims to mitigate the impact of COVID-19 through the food security program. These are only some of the solutions that we have seen in the past months, but at the core of these hardships we are facing relative to the pandemic and GBV is our fight to strengthen our institutions to allow survivors to seek help and to effectively hold perpetrators into account. Thank you very much.
Thank you, Liza. This is all very very interesting. I noted down your mention of a lack of trust in the justice sector and the search for alternative forms of visibility and solutions for the problem, which of course raises the issue of sustainability. So thanks for mentioning that aspect as well. I'm now giving the floor to Fabienne van der Rede. Fabienne, the floor is yours. And you may have to unmute your microphone. Thanks.
Can you hear me?
Yes, please go ahead, Fabienne. Now you're muted again.
Can you hear me?
Yes, now yes.
Right, I'm increasing my digital skills at the moment. So good morning, good afternoon, or good evening, wherever you are. So I'm Fabienne van der Rede, working for the European Commission, and I was asked to say a few words about our experiences in the light of the Spotlight Initiative. Beatrice from UN Women already referred to the initiative. I mean, UN Women is one of the partners of the initiative. In a very few words, what is the Spotlight Initiative about? It is a global multi-year partnership between the European Union and the United Nations to eliminate violence against women and girls. It was put in place end of 2017 because of all the challenges that have been told by the previous speakers. We are actually working in a limited number of countries where we have a comprehensive approach, and we really try to use a bottom-up approach, which means that contextualizing was of course very important, and so programs were really designed on the spot in country in close consultation also with civil society. We have a number of countries, and these we complement these country programs with a lighter regional program in the different areas. As I speak, the Spotlight Initiative is now ongoing in 24 different countries and in 3 different regions. If I speak of a comprehensive approach, a lot of it has already been said. We really try to bring 6 outcome indicators, outcome areas together. First of all is working on the legislative and the policy frameworks. The second one is really working on the duty bearer side to work on the capacity strengthening of the different institutions, both at national and subnational level. The third pillar is really working on prevention, as we already heard, working on social norms, attitudes, behaviors. Very important, as was mentioned by some participants, was the involvement of men and boys, traditional leaders. A lot is done through community mobilization and try to promote positive masculinity. The fourth outcome areas is work on accessible and affordable comprehensive services. The fifth one is on data collection, because we all know data is important for reasons of accountability, but also to be informed and to have informed policies in place. And the 6 outcome indicators was added after consultation with civil society, was really a pillar specific for the support of the national women's movement, the women's civil society. Their importance was already underlined by previous speakers. When so the Spotlight Initiative is now up and running for a good year in a number of countries, and when the COVID crisis hit it, let's say the world in February, March, I think we all realized very quickly that this could aggravate the many challenges that we had already and rise the levels of violence. So we immediately reached out to all UN officers and EU delegations in country, asking really to redirect and refocus investments, which has happened in the last weeks. I think we managed to redirect and refocus over $20 million. We asked especially to work on boosting the prevention, so really trying to do social campaigns, awareness campaigns on the prevention, on the risks of the increase. On the one hand, and on the other hand, it was really a request to increase the services to the victims of violence. As we all know that with COVID, mainly the accessibility and the availability was a problem. We saw that in a lot of countries, the remote service delivery was scaled up. I've taken a few examples because I was asked to give a few practical examples. There are, of course, very much more, but we see the use of a lot of digital solutions and also mobile solutions. So we saw an increased investments in mobile clinics and mobile one-stop centers. As already mentioned, there was an increase in the use of free toll lines and hotlines. In Uganda, for example, legal service provision was done through voice messaging applications to bring services closer to the survivors and also to improve incidents reporting. I have examples from Kyrgyzstan where counseling was done through virtual chat functions and where pro bono lawyers were engaged for online consultations. In Zimbabwe and Papua New Guinea, solutions were looked for alternative transport modalities and emergency accommodations. I think in Zimbabwe, a kind of a service shuttle, bus shuttle was put in place because public transport didn't work any longer. And in a number of countries, we see that sports centers, hotel centers, even churches were repurposed to become safe spaces. In a number of countries, we also had support to police victim support units, and mentoring continued, albeit virtually, but also by provision of transport and mobile phone, for example. Last but not least, of course, in the Spotlight Initiative, work was also done with the government directly to establish their COVID responses, also to cost these COVID responses, and to make sure that gender-based violence was taken into account in these responses. Voilà, I know my time is limited, so I'll leave it here. Over to you. Thank you.
Thank you, Fabienne. Thank you for highlighting the Spotlight Initiative. And the repurposing of activities and the refocusing of investment, I think, are crucial at the moment. And with that comes also the issue of innovation and finding solutions that work at the moment, but they're also sustainable at the same time. And that brings me to my next speaker, who is our country manager of IDLO Mongolia, Tara Neal, who will share with us some of the local solutions and challenges as solutions that apply to the country and the region as well. So Tara, the floor is yours. Thank you.
Thank you very much. Hello, everyone. Thank you for inviting me to talk about Mongolia. We've had a very unique situation here, so I'd like to give you a bit of context for Mongolia before I talk about the impact of COVID-19. So Mongolia is a very large country with a very small population. It's the 20th largest country in the world, but the population is only about 3.2 million people. And almost half of that population, 1.5 million, live in the capital city. We share a border with Russia in the north, and then a 4,600 kilometer border with China in the south. There is a small population, but 30% of the population lives below the poverty line. So even before COVID, gender-based violence was a very large problem here. There was a study done in 2017 where almost 8,000 Mongolian women were interviewed about their experience with violence, and 57.9% of those women that were interviewed reported experiencing some type of violence in their lifetime. And 35% reported experiencing violence in the past year. They also found that 1 in 10 Mongolian women have experienced sexual abuse before the age of 15. And again, as in the other countries we've heard about tonight, reporting of violence is low. And in the same survey, 26% of women said that they didn't want to report because they did not want to reflect badly on their family. So here in Mongolia, IDLO is implementing a project to strengthen the response to gender-based violence. It's funded by Global Affairs Canada. And we're working across 3 areas. We're doing research, we're doing capacity building for justice sector and civil society, and we also have a legal awareness component. So because of the long border with China, restrictions in Mongolia began at the end of January. And we are still under restrictions. So schools were closed, and they've been closed since the last week in January. Children have been restricted from recreation centers, cinemas have been closed, children are not allowed in grocery stores and shopping malls. And have really been confined to the home. And when the first case arrived here in a businessman traveling from Europe in early March, they closed the borders. And the borders have been closed since March 10th, and they will continue to be so indefinitely. So the benefit of early restrictions has been that we've had no community transmission in Mongolia. The downside has been the restrictions and the length of time that they've been in place have really impacted on gender-based violence. In the first quarter of this year, the police reported a 47% increase in the number of reported incidents from the first quarter of 2019. There was an 88% increase in the number of clients seeking services from the one-stop service centers. And there was also a dramatic increase in the number of calls to the child helpline. So comparing data from February of 2019 and February of 2020, there was a 46.8% increase in calls to the child helpline for violence against children. Of course, the triggers, as I mentioned, the restrictions have led to additional care work, unemployment, changes in routine, which have caused a lot of stress in families. And also bars began being closed at 10 p.m., which has led to an increase in alcohol use at home, which has also exacerbated gender-based violence. So through our project with IDLO, We've taken a number of steps to try to help victims as well as our government and civil society partners during this time. We reached out to our civil society organizations operating shelters and asked what they needed. And they all needed supplies. They needed face masks and hand sanitizers and other cleaning and hygiene products so that they could continue to keep seeing clients. So we purchased and donated to 13 different shelters and one-stop service centers here in the city as well as in the countryside. We worked with one of our civil society organizations to develop and print 3,000 copies of a workbook for women who are at risk of gender-based violence or who are currently experiencing it. It's a workbook that gives them information and also provides a list of resources. So we helped distribute those, and then an online training was done through Facebook Messenger for both victims on how to use the workbook, as well as other civil society organizations on how to effectively use it. We also partnered with a couple different government agencies, the Authority for Family, Children, and Youth, and the National Legal Institute, to do a number of programs using Facebook Live, using FM radio, using the local TV station, and also developing videos featuring lawyers and police officers and CSO experts giving advice on what to do for assistance if you're experiencing gender-based violence. And we ran short videos on buses, bus screens, video screens throughout the city. Thank you very much.
Thank you, Tana. Thanks for giving the country perspective. And the time is quite tight, and the discussion is so interesting. And there are so many questions coming in. So here are a couple of questions, one from Myanmar and one from India, about the digital divide. So maybe Fabienne, you can help us answer a couple of questions having to do with the current tendency under COVID-19 restrictions to move to online digital solution, digital awareness, which might further marginalize women without access to technology. Our colleagues from India signaled to us that not all countries would have infrastructure, for example, to support women and children with the latest technology. And colleagues from Myanmar are asking us to share examples of where such initiatives might have been combined with better service, legal aid, and health access in a COVID reality that have worked beyond increased digitalization. So, Fabienne, over to you.
Okay, thank you very much for these very important questions. I think the digital divide is something which was already there and which now only has been exacerbated by this, let's say, crisis. I don't have at hand all the things that have been happened within the spotlight, but I know that for the time being we are gathering lessons learned, and we're putting everything on the website, as well as good practices, lessons learned that could be used out of this COVID crisis. Now, it is absolutely clear that we need to have a focus on vulnerable people, especially those that are furthest left behind and are even further behind because of this crisis. What we have tried to do, just as an example, within the Spotlight Initiative, is really try to reach out to the grassroots organizations, which very often we try to have a focus on the woman-led grassroots organizations, which are really closely embedded closely with the communities, which are really embedded with the communities. And in the last weeks, we've been working very hard to try to give them the additional resources because of the absolute crying needs that they had. First of all, needs simply to be able to continue to work because the COVID crisis, of course, made it much more difficult to work with closures, with lockdown. Secondly, to adapt to the new realities, which indeed were through digitalization. So this can be through equipment, but can also be through capacity facilitating a lot of things. I mean, I'm myself not a digital expert, but I know that a lot of solutions also have been able to give through phone and the use of mobile phones and apps. And then the third thing is that we also try to provide women's organizations, grassroots organizations with the much needed lifelines, as you know. There was really a cry for core funding just to be able to make it, to ensure the staff well-being, but also that the staff knew how to handle in these new environments. So I think this might just be one example of what we did, really to try and reach out to the grassroots organizations who are really closest by the remote communities. And as I said, a lot of mobile, I mean, with mobile clinics, trying really to go, if people can't come, to try to go to the remote places or where people don't have the possibilities to enjoy any services. Voilà, I'll leave it at that. Thank you.
Thank you, Fabienne. We have a couple of questions, and notably one from Jordan on alternative dispute resolution in time of COVID-19, and perhaps Liza, you can help us answer some of these questions having to do with colleagues are wondering whether our alternative or informal dispute resolution mechanisms could be considered an effective restorative or preferred method in some cases, taking into account, of course, the lockdown and the closure of state courts in many cases. So an enhanced use, how do you see an enhanced use of alternative and informal dispute resolution mechanisms in this case? Liza, over to you.
Yes, thank you for that. Thank you for that question. Actually, that's one of the innovative solutions that I would also like to highlight in the Bangsamoro Autonomous Region in Muslim Mindanao. It's a conflict-affected area, and we're just starting. And in this case, we're implementing some transitional justice mechanisms, and one of them is utilizing alternative methods of dispute resolution or alternative ways of trying to access justice. We've partnered with religious leaders, local leaders and traditional leaders, for example, and most of them are men. There is also a partnership between the social welfare agency or ministry with UN agencies and civil society organizations in creating referral pathways, for example, for child protection and gender-based violence survivors. And these include the entire community, all the stakeholders in the community that would try to help resolve the issues. We also have issues on early marriage, just like in other countries. And the way to resolve that is by making sure that all of the stakeholders are involved, especially the religious leaders and the traditional leaders, and most especially the men. If we won't be able to resolve these issues of gender-based violence and child abuse if we do not get the men involved and make them responsible in ensuring that women and children are protected. Thank you.
And thank you, Liza. There are several other questions. I would like to highlight one question from ODI on the need to document these stories, local solutions, innovation stories. So this is a question for all panelists, also the previous panelists, of course. Do you see an opening or a space where documentation, research, the gathering of local stories, local innovative solutions, emerging solutions can take place? And or do you see some emerging platforms where such a collection of stories could be placed? Anyone from the panelists who wants to answer this question? Perhaps Professor Mary, you have an insight since you're coming from academia, and or even on the validity of having such a platform, not necessarily knowing a platform, but do you think that a collection, or Liza, maybe you want to speak on that? Do you think that local solutions and innovations would be valuable to collect them in some way.
Yes, yes, I would agree. In fact, I was thinking about writing all of these experiences, documenting the experiences of Moro women, minority women, and indigenous women in the Philippines, with the hope that the documentation, all of these innovative solutions that we have discovered might prove useful also in other contexts, in other countries. So I think that would be very, very valuable.
Yes, and I'll just add to that also. I completely agree that, you know, this is a wonderful opportunity to be learning from the innovation that's happening on the ground, and we should absolutely be collecting those stories and learning from them. So thank you for mentioning that.
Thank you. And we also have an additional question to UN Women from the Netherlands, from The Hague. There have been reports that with COVID-19 restrictions, there has been a rise in domestic violence and intimate partner violence. Have any special steps been taken to address this issue? So this is a question about intimate partner violence and the steps that have been possibly taken to address the issue. Beatrice, the floor is yours.
Thank you very much indeed. I think one of the important outcomes of the COVID crisis has been the extent to which it has forced society to be innovative. And so, indeed, a number of countries, both developed and developing, are undertaking a lot of innovative approaches to address intimate partner violence. So just by way of one example, in the Canary Islands, I think located in Spain, if a woman senses that she is going to be in danger in her home, what she can do is to go to the nearest pharmacy shop. And when she gets there, she can just signal, make a sign with her hand that, you know, something is happening to her. And when the pharmacy sees this signal from the woman, immediately the police are called. And either she's asked to go home to meet the police there, or she's accompanied back home with the police. So several innovative ways are being generated across the world, but the most common platform for addressing violence has been through social media, where women really signal that they are going through a problem, and where women also provide support to other women based upon their experience. So I think we really have to document some of the urgent and important outcomes of COVID, because it has really taught us to begin to think out of the box and to no longer rely on face-to-face approaches for addressing important social issues. Thank you very much.
Thank you. Thank you, Beatrice. And we are coming to a close of our meeting. And I would like to thank all participants, all of you who have joined today to support this initiative, to talk about GBV, to talk about the need to address these issues on an urgent yet sustainable manner. A special thank you to our panelists today who have dedicated the time to join us for this meeting. It has been a pleasure to have you here. And thank you also for being so active in the chat I see the messages scrolling through. It's so nice to see a large community of colleagues and friends joining together to share a common message, and of course to find innovative solutions. This was really the hope for our discussion today, to talk about the challenges, but to focus on the positive aspects, the solution aspects, the sharing of lessons, the sharing of emerging practices in the justice sector that could help make an impact in the field. And I think we succeeded. It was wonderful to hear your respective perspectives and to see all questions. Again, apologies, we have not been able to answer all of them live, but we'll try our best to reach out to you bilaterally and follow up individually. So a big thank you again from IDLO, from all colleagues, and looking forward to keeping in touch. And please feel free to, of course, to reach out if there is anything we can do for you, or just to be in touch. Thank you, everyone.
Thank you. Bye.
Thank you. A good continuation.
Thank you. Bye.
Bye-bye.
Thank you.